Welcome back to Relaxation Dentistry with our very special guest, Dr. Doug Cast. Now, here's something that I recently learned, and I think a lot of our viewers will be shocked to learn as well, and that's that dentists don't have to have any special or additional training to call themselves a cosmetic dentist. Is that true, and why is that?
There is no recognized specialty of cosmetic dentistry by the American Dental Association. There are endodontists who do root canals, who nobody likes, oral surgeons, orthodontists, periodontists. Those are all board specialties. But there is no specialty recognized by the American Dental Association for cosmetic dentistry, so any dentist can say that they do cosmetic dentistry. You do not have to have any training for it. Which leads to the big problem is when some people think that they're having white fillings or they're having veneers, they don't know about what type of materials are going in, and they don't know that much about the training of that particular dentist.
Now, speaking of that, I know a lot of people sitting at home are wondering, what kind of training do you have? Can you elaborate on that a little bit more about your training in cosmetic dentistry?
Yes, it actually is. It started in after I got to dental school. I was doing traditional dentistry and wasn't really happy doing, amalgam fillings and the crowns that have the dark lines along the gums, but that's the way we were taught in dental school. So actually a friend of mine who, he and I went to San Diego State together, he became a very prominent national speaker, and we were talking, and he said, here's this school you should start to go to learn how to do cosmetic dentistry, and it was called Las Vegas Institute. So I've taken several classes from cosmetic dentistry to full mouth reconstruction, TMJ problems. Eventually, I became a clinical instructor there and was an instructor there for several years. And then I lectured with LVI across the country and then across Canada. So in addition to a tremendous amount of class, I actually think that I spent more years and more money on my cosmetic training that I did at Georgetown.
So you've had an extensive amount of training, so anyone sitting at home could be very confident in trusting their smile with you.
I hope so.
Now tell us about relaxation dentistry and cosmetic dentistry and how these two things work together in your practice, and what are the benefits to your patients?
Well, they work perfectly because a lot of people are unhappy with their smile, and part of it is because it's old dentistry. There's some psychological trauma that we talked about from back when we were kids and how we were treated. Relaxation dentistry and sedation dentistry combined allows us to solve the dental problems and give them the smiles that they want in a relatively short period of time. And it's the number of patients that are just deathly afraid. I have several patients that they honestly cannot sit in the chair when I walk in the room. And so I tell them, one of us has got to sit in this chair. And then so we go through and I listen to what their problems and their concerns are and what their goals are and see if we match up. Because I know that I honestly don't treat patients in my practice that I don't connect with. Just like I'm sure the patients go, I can't connect with that dentist. What they don't know is if we can't connect with them, there's got to be a relationship where I go, I like that person, and hopefully they feel the same way. So using the relaxation and sedation techniques allows me to give them the smile that they want in as little as 1 to 2 appointments. It's fantastic. After they've gone through it a couple times and they've gotten over that fears, I have several patients that go, I don't even need the pills anymore. I'm comfortable, let's just do it.
And really that's because of the conditions that you set up that you mentioned earlier with the massage chair and the aromatherapy, that all of that lends to someone feeling relaxed even though they may be having an extensive procedure done.
Yeah, and I think that more importantly than that, it comes back to respect of that person and to respect that their experience that they had was very real, and then working through that and not repeating the same mistake. And you find that when you do that, people want to look better, they want to feel better. And if you treat them with respect, and then you bring in this armamentarium that we bring in, it allows you to treat a whole segment of the population that before was just deathly afraid to even come out and seek your services.
I've been reading more and more about how bacteria in people's mouths can lead to heart disease and Alzheimer's disease, even diabetes and low birth weight. And medical research is linking oral bacteria to chronic inflammation in the gums, which sets off medical problems.
Right.
And now I hear that bacteria can actually get into our bloodstream and can actually cause heart disease. All very serious problems. Can you elaborate a little bit more on that for us?
Yeah, it's an excellent point, and they've done research and found all those diseases are associated with the oral bacteria, and we'll break them down to the ones that you said. Alzheimer's. When you build up bacteria in your mouth, your gums will start to swell up. And a lot of people think when they floss there's a little bit of blood, and they think it's no big deal. And when patients tell me that, I go, is there any other part of your body, when you touch it, do you bleed? And they're going, no. Well, no part of your body should bleed when you touch it. So the floss, the bleeding on the floss is a sign of inflammation. Chronic inflammation, this is like a mantra we have in our office, chronic inflammation leads to chronic disease. Chronic disease is expensive and deadly. So getting back to Alzheimer's, they now believe that chronic inflammation, starting at the age of 30, increases your chances of being an Alzheimer's patient by the age of 70. So even if you have slight gingivitis from the age of 30 to 70, you have an exponentially higher chance of being an Alzheimer's patient because of inflammation. And then you talked about heart disease.
Heart disease, yes.
Heart disease with the bacteria that builds up, settles in the heart valves, it creates problems. But the bigger thing that we're finding out, and this is an interesting one. I'll tell you a story on this one. We actually have a facial plastic surgeon that works in our office, and I had a patient who had extensive amount of tartar buildup, and her gums were just bleeding. You just look at them and they start to bleed. So I was going over with the patient, and I was talking to her about the dangers of a substance called C-reactive protein, which is made by the liver. When there's chronic inflammation, your body sends a signal down to the liver, which creates C-reactive protein. That C-reactive protein starts to harden the blood vessels, and then it destroys the inner layer called the endothelium. When that destroys the inner layer, it becomes stickier. Then as cholesterol travels through the blood vessel, it starts to stick. Well, most people measure cholesterol, and they don't measure the C-reactive protein. So I told her, and all you have to do is Google this, and you'll find I'm telling you the truth. The C-reactive protein marker is 400% more accurate at determining future heart disease than cholesterol. It's the reason why 1 out of 2 people that have a heart attack or stroke have normal cholesterol. So when the patient left, the facial plastic surgeon called me and he goes, all right, Doug, what did you just tell your patient? So we went over again. He goes, I got to tell you a story. I had a patient last week who was scheduled for a 7-hour facelift. He's 45 years old. His physician did a blood workup before the surgery and asked specifically for CRP. And I've never seen anybody ask that before. And then he was told they canceled the surgery because the CRP level was so high. They thought the patient was going to die of a heart attack during the facelift surgery. So they put him through thousands of dollars of stress tests and echocardiogram. And the plastic surgeon said, I have never, ever heard of that before. And when I heard you tell your patient that, this is the first time I totally understand C-reactive protein, which was to me was kind of interesting that the physicians don't know about it.
When we come back, we're going to talk more about one of the 3 simple procedures you can do today that will reduce the deadly amount of bacteria in your mouth and improve your smile.